Okay, as Leah said, we were giving a couple more minutes, but I think we're there. We have our participants. I'm Walter Proper and the Executive Director for IAPHL, and thank you for tuning in. And I'm now going to go to the slides, and you'll see the slides. And I should introduce Leah, who is really going to lead this, who's a senior advisor at JSI. So without further ado, I think we'll just go to the slides.
Thanks, Walter. My pleasure to join today. Good morning, good afternoon, good evening, wherever you are. This will be a webinar on a simple tool created by JSI and IAPHL to complement the WHO's COVID-19 Essential Supplies Forecasting Tool. Let's see if I can proceed. This is a second of a two-part series on a freely available tools to support quantification for COVID-19 related commodities. Walter and I will be presenting this presentation. We will do an in-depth walkthrough of the supply planning tool that complements the WHO COVID-19 ESFT tool. And we welcome any of your questions into the chat or after or during the presentation. And Walter, if you could let me know if anything comes through that I could answer while I'm presenting, I could do that. But if we want to save them till the end, that's fine as well.
Do.
Okay. So this presentation probably will not make a whole lot of sense if you did not attend the first one, but we'll try our best. I encourage you, if you're interested in this tool, to go back and review the first webinar that was done on June 19th. It was conducted by CHI, the Clinton Health Access Initiative colleagues who worked on WHO's COVID-19 tool, and they did a walkthrough of theirs. That recording can be found on the IAPHL website under the COVID-19 button, or under resources down to webinars. And the tool itself can be found through links provided on IAPHL, but also at the WHO international site under publications. And it can be downloaded there. This is what the screen would look like. Let's just review what quantification is. Quantification is a process for estimating the quantity and the costs of products required for specific health programs or services, and determining when those products should be procured and delivered so that you have an uninterrupted supply of products. There are 3 steps usually in quantification. The first one is represented in the box here, preparation. In the blue box, the second step is forecasting. And in the last box, we have supply planning. What the WHO tool did was emphasize number 2. It uses epidemiological models and facility constraints such as staffing and beds to determine how much products would be needed in terms of demand for those products from a weekly basis. What our tool does is take that information and do a supply plan for them. So if we go, and I will walk through the tools themselves after all of this, but I want to show you screenshots. Our tool, the supply planning tool, was solely created to accompany the WHO ESFT. It really does not make sense as a standalone product and should not be used that way. The WHO COVID-19 tool provides short-term weekly forecasts that are limited by the constraints in the health system. They forecast the demand for pharmaceuticals, equipment, consumables, and accessories. And when you go to the tool, and version 3 is a new version, there will be a tab once you're done with determining all your limitations and constraints and variables in your health system and in your model. You will have results that come out under the tab called Commodities by Week. Our tool for supply planning can be accessed through the IAPHL.org website. If you go to that website and you click on the COVID-19 button, which looks like this, you will be able to find a link to the JSI IAPHL supply planning tool. Once you have downloaded the simple Excel-based supply planning tool, you can read some of the directions, but the first thing that you would need to do is enter your supply plan parameters. The supply plan parameters have been determined to use resupply periods in terms of weeks and safety stock as a percentage. We attempted at first to try and see if we can use months of stock and average monthly consumption in the calculations, but because COVID-19 and the models that come out of the WHO tool give a very peak and trough type of demand forecast and are not consistent in terms of supply needs, give very inaccurate results in terms of average monthly consumptions and months of stock. And the solution, we think, in this case was to apply a resupply period and a buffer stock instead. So in the first page, you would be asked to enter your resupply period in terms of weeks and the safety stock parameters. The second step is to move the forecasts that have been created in the WHO tool into the supply planning tool. So you're directed to copy and paste the cells and the actual J9 through BJ84 from the WHO tool and hard paste them directly into the weekly forecast data entry tab in the supply tool. And the hard paste just means you're copying over the numbers and not any of the formulas. The dates accompany this as well. So you'll have above here, above the number of weeks, the dates for which those weeks start. Once you've copied over your weekly forecast, you have two possible ways of proceeding. The tool converts these weekly forecasts into monthly forecasts. So if you're using any other tool such as Pipeline, you can just head over to the monthly forecast estimate tab and copy over the monthly rounding of those weekly forecasts and apply it to your any other tools. The second option would be to proceed over to the supply planning weekly tab. When you open the supply planning weekly tab, you'll be asked to enter in the resupply, the inventory quantities, any adjustments, and any beginning balance stocks that might be needed or anticipated shipments. Step 3 determines what your resupply timing and quantities would be. So for any of the yellow cells, the user is able to enter their, here you can see for chlorine, 70%, we can enter a beginning balance at the top yellow cell. If there are any anticipated shipments, they can also be entered in for the weeks that they are anticipated to be available in inventory, and any stock adjustments such as transfers from facilities or losses can also be entered in. The weekly forecast will automatically be transferred from the weekly forecast data entry tab, and order recommendations will be calculated in the green rows. In the shipment summary tab, all of those green recommendations will be summarized here so that you don't have to see all of those other rows of information. The inventory order recommendations that are being made for when they should be available and entered into inventory. So close monitoring of this tool is required if you're using it, and monitoring the lead time so that orders can be made in advance before they're required to be available. So I'm going to do a quick walkthrough of the tools themselves. Let me see if I can exit out and show you those same steps, but using the tools. So this is, if you come over here, this is the WHO COVID Essential Supplies Forecasting Tool. This is the version 3. If you've downloaded any previous versions, the weekly commodities tab won't be available. This is a request that we made so that we can have a supply plan tool. Previously, only total demand forecasts were available, but we requested that they provide them incrementally to us so that they can be used for supply planning. So if you've downloaded any of the previous versions and you need to use the supply planning tool, I encourage you to go and get the newest version, which is version 3. Once, you know, I go back to the first webinar for a review of this tool. I am not a user of this tool and cannot help with questions regarding that. But once you've finished entering in all of the information, you do get your summary of commodities needed by week. And you can see there are 100 and some different kinds of commodities, and there are medication groupings, a drug module of 40, medical supply module of 40, which I have split out in the supply planning tool. We're going to copy this information. I'm going to copy that. And you can see I've started with where the dates are so that I have the date information. And I'm going to come over here to our tool. This is the JSI IAPHL supply planning tool. And I'm going to hard paste those into cells J14 over here. And this is the hard paste logo, which says just 1, 2, 3. And now I have all of those forecasts from the other tool in this tool now. And you can see the modules for medications in some hidden cells break out. So when we go to supply planning, all of those 40 products for pharmaceuticals and 40 supplies are also entered in. So let's go back to our cover page and let's assume our resupply period is, let's say, 6 weeks. And I'd like to have a 2-week buffer stock. So 2 out of 6 is about 33%. So now I should have all of my parameters to be able to do supply planning. But before we do that, let's go to our monthly forecast estimate. All of those weekly forecasts have now been converted to monthly forecasts. So if I wanted to use pipeline and had some of these products already entered into pipeline or wanted to use that tool instead, I can take these forecasts and use them in there. If I do choose not to and I want to do supply planning here, I can go to my supply planning weekly. All of those forecasts from the weekly tab are now entered in here. I can enter a beginning balance, and the order recommendations tab tells me that I needed 1,500 units for this month to be able to have a resupply for 6 weeks plus 2 weeks of buffer stock. If I didn't get that, then I need 2,000 the following week. Now, if I still didn't get that, those patients didn't get the needs that they needed. And so I only need 1,706 the following weeks, because this is an incremental weekly forecast. It doesn't add up. If you do not get the products that were needed historically, those patients will not continue to need those medications or supplies. And if I enter in a shipment, for example, here I say, yes, I'm going to get 2,030 units of such and such product, I will see that transferred into my shipment summary. And I know that by the beginning of August 29th, I would have needed 2,030 units ordered in time to be available here. And so as you can see, it's a very simple tool. There are lots of definitions for each of the indicators that you're required to enter. The cells are color coded. Yellows represent data entry. Light blues are calculated and cannot be changed. They should be locked. Gray cells come from the other tool, and green cells are your recommendations. And I'm going to stop and see if there are any questions that I can help answer during this time.
Right. I don't see any in the chat line. Oh, we have the first one. From Joe McCord, thanks team for putting this together. Does the tool use a different supply planning approach for non-consumable medical equipment items forecasted in the WHO tool?
Joe, can you say that again, Walter?
Yeah, so it's does the tool use a different supply planning approach for like non-consumable medical equipment items? So not the consumables in order to forecast in the WHO.
Yes, it does. So the consumable, thanks for pointing that out, because I mentioned that if the product didn't get used, if it's a, I've forgotten if it was a consumable, then it's lost to the supply. But if it's a non-consumable, such as, I don't know, let's go down and see if we can find something like a PCR machine, or PCR machine or such, then what was needed in week 1 will still remain to be needed throughout the course of the forecast. I hope I got that right, Joe, because I think I consulted you on that.
Any other questions? You also verbally can ask if you raise your hand. I think you can see that.
So yeah, we did have a different calculation for products that lost their life use versus those that didn't and were assumed to be continuously available and needed. So if you look at these modules for 40 patients, you can see that over here, all of those medications for those 40 patients have been broken out. And their needs will be calculated based on the module quantities.
There's another question from Terrence Fusier. If there is a difference between the forecasted consumption and the actual consumption, are you able to update without affecting the forecast?
So let's say, let me see if I can explain, see if we can do that. So if the actual, we're in the second week or third week of the forecast, and we have an actual consumption, not really, but what you could do is make an adjustment to your stock. And that's how you would be able to do that. So for example, actual consumption we didn't use 242 this month. And so the tool is calculating a subtraction of 242, but we only used 142. I can put in an adjustment of 100. But it's not using historical actual consumption to recalculate. It's only using the forecasts and your stock balances, the resupply and the percentage for buffer.
Okay. Someone who is somehow using my name is asking a question. So it will not reorder a non-consumable, but will reorder consumables, correct?
Correct. The non-consumables will continue to add up. So if I needed a PCR machine the first week, I will continue to always need that one PCR machine. But if I needed alcohol pads for the first week and I didn't get them, I won't continue to add them up into future needs.
Okay. And then in the chat, we have, can the tool be applicable for other programs?
I mean, the math can be, but it's really meant for the COVID-19 accompaniment. It's a complement to that. If you're using it for other programs, the best method for recommended method currently, if you don't have any other systems in place, is to use average monthly consumption and months of stock when you have consistent demand and forecasts in place. So this tool is not recommended for any other program, not only because the inventory management practices aren't meant for programs that are more chronic, or the needs are there consistently, but also because the products that we've listed here are not those that other programs typically use.
Okay.
There are other tools that do supply planning and forecasting for other products. Currently, Pipeline is available for supply planning, and that is freely available. And I believe that FHI 360 under the GHS CPSM program has recently developed a new supply planning tool that they will be, I'm sure, marketing and sharing information with as soon as that tool is finalized.
Okay, there's another question. Terrence again, can the tool be adjusted to capture the expected shipment that is in the pipeline? I think it does that.
Yeah, so if you go to supply planning and you have other shipments that that are coming in, you just place the quantities and the amount in the week that you anticipate them being available. So here I've got, 3,000 units of this coming in, then I don't really need anything else. My recommendations go down to 0. You just need to make sure that the lines here under shipment and under order recommendations represent when they're available. So if I have 3,000 anticipated here, probably means that I've ordered it way in advance than, September 19th. I've accounted for the lead time.
Okay.
And I think I know Terrence. Hi, Terrence. Hope you're doing well.
Okay, I don't see any more in the Q&A or in chat now.
Okay.
Yeah.
Well, if you have any questions, is there a way for questions to be sent later? If you have my email anywhere, I'm sure I can be.
And you can always ask the question even on the listserv.
Yeah. Yes, that's the best place to do that, so others can hear your questions and answers.
And I would say for those of you who may now be going back to the tool, the original WHO tool, then people have asked the question on the listserv if they get stuck, and they get answers from everywhere for other people who are using it. So please, as members of IAPHL, please, use the listserv, write your question, and I'm sure you'll get an answer, including from Leah and Joe and others at the JSI office, but you also get it from other people around the world who are using the tool, and if they have a question, it gets answered quickly. Okay, well, I want to thank Leah for this, and I hope this was informative to everyone. And again, this is recorded, so this will be on the IAPHL website, and so you'll be able to access it again, as well as the original the recording when we introduced the WHO Tri-Develop tool. So both of those will be on our website. Thank you again, Leah, and we'll say thank you to everyone.
Thank you so much.
Have a good day, good evening, or good morning, depending on where you are.
Take care, everyone. Be
Bye.
safe. Bye.
Yeah.